Hi everyone, in the course of shooting a whole lot of training videos for the physiokey and the spinal, our wonderful talent here, Deb, has actually got some pain. So tell us what you're feeling, Deb.
Yes, I've had some bad pain for about 5 or 6 months, a lot of tightness and tension.
And whereabouts are you feeling that?
So I have some sensitivity in my spine right here that's pretty tender to the touch, and then some pain down in my lower right side of my back.
And can you give me a number out of 10 for the spine?
Yeah, I would say when there's pressure on it, it could be up to a 7.
A 7?
Yeah.
So sitting there, are you aware of it in between your shoulder blades?
Yes, I feel it. It doesn't feel great. It doesn't hurt as much as when there's pressing.
So what would you give that out of 10 now?
Probably a 4 or 5.
And what type of pain do you feel that now?
It's just almost like an ache. Yeah.
Deep ache?
Yes.
Yeah. And is it constant? Or is
Yes.
it constant? And tell me about the right side.
This one just seems to come and go. So when it comes, I would say it can get up to a 7 as well.
And
right now, I don't feel, not at the moment.
Are you aware that this side is different to that side?
Yes, it feels tighter.
It does feel tighter.
Yeah.
And that's all there is?
That's it.
So sitting there, you're aware of the pain. Are you
That's
okay
right.
sitting there to be treated?
Yes, I am.
Okay, all right, let's get on with the treatment. All right, so what I'm going to do for Deb is, first I'm going to do a spinal cleanse down the spine. I'm going to do it in individual. So there's no need for me to remove any clothing. What I'm going to do is just shift that clothing. You're okay with that, aren't you, Deb?
Yes.
I'm going to come down here and then I'm going to see where the body takes me and focuses. So first of all, cleaning the electrode head. I'm going to choose individual to begin with. Just remember, always start simple. Don't try and choose the most amazing setting, that you just think. Choose something that you're comfortable with and that you know that hopefully in your experience is going to get the effect. And if it's not working, change your setting. All right, so I'm going to start here just above C7. Deb, tell me when you can feel that. Can you feel that?
Yes, I can.
Happy with that? I'm
Yeah.
just going to check. All right, so you're okay with that?
Yes.
And I'm going to begin dragging slowly. And just tell me, Deb, if there's any areas that you can feel the impulse more.
Right there.
You're fine. So I'm going to stop there for 30 seconds. Now the spinal cleanse, as you know, in the treatment is normally 30 seconds, but you can change it. It's all about getting the results you want. So what are you feeling there?
Some relief.
Already?
Yeah.
So you saw her take that deep breath. That's a really good sign. That's sticky. So I'm just going to stay there a minute longer. And the impulse, is it a pin? Is it spreading? Yeah, but you're okay with it.
Yeah.
I'm on a low energy setting. It doesn't matter what the energy setting is as long as your client is comfortable.
Right there.
Okay, so look at that red spot here. So I am going to go back there after I finish this spinal cleanse and focus on it. It's stuck again, so I'm going to move. You're okay with that?
Yes.
Okay, so I'm going to come down. Doesn't matter if I disconnect the device as long as I run all the way down. So I'm going along the spinous processes here. Obviously, if someone has any sort of scoliosis, you're going to have to follow the spinous processes. Not picking up any stickiness. What are you feeling there, Deb?
Yeah,
Here's
that's
one.
fine. Okay.
So I am going to assess Deb's pain levels even after just doing this spinal cleanse, because it can always take us into a different direction. And I am going to go all the way down to the coccyx, and I'm just going to slide the device underneath the trans. Okay with that?
Yes.
And stopping there. Okay. So Deb, tell us what you're feeling in the middle of your scapula there.
Yeah, I feel a little bit of like looseness, like
Yeah.
A little bit of release, yeah.
Yeah, and what about down here?
Yeah, that one wasn't too painful, so I feel like that one's still fine.
Okay.
Yeah.
It still feels different to this side?
Yeah, maybe a little bit. Just
Okay.
a little bit.
Right, so now what I'm going to do is, can you just put pressure on that for me and tell me
Sure.
if that's different?
Yeah, wow, that's definitely better.
So it's still, it was a level 7 before? What is it now?
When it's pressed on it, yeah. It hardly feels like anything right now.
Okay.
So that's great.
So I'm going to choose relaxation. I'm just going to focus on that area here. Can you feel that?
Yes.
Are you happy with it?
Yes.
So I'm just going to work this area, top to bottom, bottom to top, right to left, left to right. Okay, so it's grabbing here. You okay with that?
Yes.
Now I'm going to do that 3 times, nice and slow, even pressure as best I can. 3 times that way. Quite a bit of resistance there, just on this spot. And hopefully you can see that little red spot there. So I'm focusing on that. That's quite sticky that way. Not sticky that way. So I'm going to go that way. And hopefully by doing that, this spot is going to dissipate. Big breath, that's what I want. She's starting to relax more, that parasympathetic response. And you can see the change in the body language, her head's starting to loll around as she relaxes. That's good. A little bit more there. So normally that, Deb, would that be painful for me to do that?
Yeah, a little bit.
Pressure?
Yeah.
Okay, so just move your shoulders and tell me what you're feeling in between the shoulder blades.
Oh wow, yeah. So now I feel like a tightness kind of like in here.
Right, so we're peeling the onion. So now what I'm going to do is I'm going to do a neck zone in trigger to release that tightness. So, can you feel that?
Yes, but just a little bit.
Do you want more?
Yes, please.
Now?
Yeah, maybe a little more. Yeah, that's great.
Okay. So we're going to just do a general neck zone. Okay with that?
Yes.
So I'm stopping on sticky areas and waiting a few seconds. I'm going to do this, I like to do this 3 times. Center, out, 3 times, and still that stickiness and redness is there. One more. So I've used 3 settings so far. I've used individual, relaxation, and trigger. So what I've had is a modulated frequency in individual, and then I used relaxation, which can be a high frequency because of its intensity, and then trigger, which is a low frequency. So all through this treatment, the body does not, another deep breath, get a chance to ignore what I'm doing. I'm just working that stickiness. And then we'll assess. So what are you feeling now?
Yeah, still tight, but I think a little bit looser.
Where are you feeling the tightness?
Right here. I'm like on the tip. It's like moved a little bit. I think
Okay.
it feels like a little.
So more this side?
Yeah.
Can you feel that?
Yes.
So I'm just going to hold there for a moment. So I continue here Every time I find a sticky point, I'll always stop. Now remember, you're not here to fix everything. I'm here to create a dynamic, a change in what she's feeling. And the device will continue to work once she leaves here. So what are you feeling now?
Yeah, that's better. Thanks, sorry, yes.
So go back to the pain in the middle of the shoulder. What is it now?
I would say like a 2.
And can you put some pressure on it for me, please?
Sure.
You said that was 7 before.
Yeah, I have it like down there a little bit maybe.
Okay.
But much better.
Okay, so now we're going to just go and treat the lower back for a moment just to finish off. So now we're going to move our treatment down to treat these spinalis muscles either side of the spine. And is this where you feel the tightness?
Yeah.
So I'm going to use relaxation and treat this side and that side. So can you feel that? No?
I mean, a little bit. That's better.
That's
yeah.
better? Okay, so I'm going to brush just this side. You're feeling that?
Yes.
It's a little bit sticky here. And I'll just give it 3. And you can probably see that redness here, so I'm going to focus on that. Sticky that way. You're okay with that, Deb?
Yes.
So the redness is not from me pressing and brushing, it's the body showing me where to treat it. As you can see, that's starting to disappear. So that's perfect. That's what I want. It got red and now it's starting to dissipate. And there's no more stickiness. So I'll treat the opposite side as well. Always good to do that to balance the person. And it's not sticky at all. So Deb, move around a little bit. What are you feeling?
Yeah, a lot less tension. That feels great, actually.
Great. Thank you very much.
Yeah, thank you.